Jeffery Hampton.
Austin Baskin.
Good to see you, Doctor. How are you?
Doctor.
How's work going today, man? We're on lunch break.
Work is hectic. Despite the
Yeah.
last hour, I just kind of lost track of time, but
Yeah.
you know,
When it comes to all the
just a part of it, man.
when it comes to all the documentation and juggling patient care,
Yeah.
it just becomes like a flow.
Yeah, you definitely develop a flow state just like you do on the pickleball court, right, guys? But you know, when you're doing it for a long time, and you kind of have these patients that you're evaluating that are developing this routine, and they're scheduled with certain people, you're like, okay, clock in. You're mentally sharp at this point. Flow state. See this person, do this with this person. I'll wrap around here. We'll run X, Y, and Z, and then we'll do this stuff. You know what I'm saying?
I think when you enjoy something like what we do with physical therapy and pickleball, we can tap into that flow state more.
Yeah, yeah.
But if you hate your job, like the time goes by so slow.
It's the energy too.
It's the energy.
It's the energy.
And
I
time-
truly believe that if we all have the same, we all have very similar frequencies, and I believe it when Robbie says that. And I know you know how we all kind of exude this our own electromagnetic field, right? I think it rubs off on the patients, and if there's one opinion that I get all the time from patients, it's I love the energy in here, and I love the culture that you guys have created. So like that's the biggest part. That's what makes it easy on my end. You know?
Dude, it's crazy. I don't believe that we seek things. We do seek things, but I believe we're called to things.
Yeah.
I lived in Starkville, Mississippi, like central Mississippi. I thought I was going to be working there in that area. If you were to ask me, oh, you'll be working on the Mississippi Gulf Coast, you know,
like,
2
yeah.
years ago, I'd be like, bro,
No way.
chill,
Yeah.
settle down. But here we are, you know. So I believe in destiny, we're called to things, and here we are.
Everything
you know,
happens for a reason.
podcasting. Yeah, podcasting. But yeah, man, tell me about what are some things that are exciting right now going on from your point of view in the physical therapy world. What are some exciting topics?
Exciting topics. For me personally, dry needling for me right now, right? Just because it's such it's still new to me.
Tell me if I was a patient, kind of tell me what it does.
Okay, so dry needling essentially is something that is going to stimulate and facilitate an artificial inflammatory response. It's doing a lot of cool physiological things. It's in layman's terms, this is what I would tell a patient. So you have a lot of stiff tissue, very taut bands, right, that we want to release, and we want to create some relaxation throughout that muscle. So how are we going to do that? We're going to create a twitch response with these needles. Sometimes you don't get it, but the needles creates this down regulation of spontaneous electrical activity, right, to help get that muscle relaxed, right? Brings in blood flow, because what happens when you have really, really tight bands? Ischemia, right? So you're not getting oxygen, nutrients to that area. So that's what we want to do. We want to open up those blood vessels, get them to get oxygen and nutrients to completely relax. So that's usually my layman's terms to a patient. What would you say?
The outcomes are positively increased when you pair dry needling with exercise and manual therapy. The evidence around that is very conclusive. But yeah, when I'm talking to a patient, I've been dry needling for around a year and a half now.
Yep.
And I've had a lot of success with it, especially with chronic pain patients. It's a great way to essentially induce a surge of white blood cells and positive growth factors to the area. So say we're needling a low back, for example. Yeah, you're going to decrease tissue hypertonicity. You're going to increase local blood flow to the area. You're giving them sensory input, something besides pain, kind of like how you stub your toe. You're currently experiencing pain. What do? You want to rub it.
Gate control.
So you're giving them that sensory input. We even, induce the electricity, the voltage, the stem to it. But my new obsession is the ultrasounded guided dry needling. That is like I'm all up into the imaging. PTs, we can do imaging now.
Yeah.
It's really cool. We're doing it here. We are one of 2 clinics in Mississippi who practice ultrasound guided dry needling.
Right.
So, like, what is ultrasound guided dry needling? We are projecting sound waves onto a patient we have the Clarius LH17, and big fancy word for you. It's like when you get a pregnancy scan, you see the baby, but we see tissues, rotator cuff tendons, Achilles tendons. We can utilize that for a bunch of extremity pathologies. We can look at anything really.
Hypoechoic reflections.
Big term right
I love
there.
saying that word.
Hypoechoic reflection.
Yeah.
So tissues where when you see a hypoechoic reflection, it's like a dark spot.
Right.
That's like an unhealthy piece of tissue. So usually certain tissues have reflect different. They reflect differently. But in general, when you're looking at a tendon, say if I want to needle a tendon, I want to put the ultrasound on it. Mm-hmm. I want to make sure that if I'm going to needle that tendon, I'm going to needle the dark spot. Mm-hmm. That's kind of the hypoechoic reflection, so like lower tissue density.
Gotcha.
But really cool stuff. That's just something that we recently introduced at the clinic. We have done a lot of training on it. Jeff's going to get that soon.
Hopefully very soon.
Yeah, very
sometime
soon.
next year.
Yeah, we always want to utilize the highest level of technology we can because we're primary care now. We're direct access as physical therapists. So what does direct access mean? Now, for most insurances in Mississippi, you can just walk through the door. You don't have to have a physician's referral. That's huge. You do not have to have a physician's referral in the state of Mississippi to receive physical therapy.
Which a lot of states have had this direct access in their states for a long period of time. But I think Mississippi was one of, maybe 3 or 4 states left that didn't have that full direct access to PT. Mm-hmm. So now we finally do, which is great.
People don't know.
Yeah.
Some people still think that, I have to go to my doctor first to get,
But it's still a new
referral.
It's still a new
It's
thing.
a new
It's still a
phenomenon,
new thing.
exactly. But yeah, for some insurances like TRICARE, if you're in the military,
You need that
You
referral.
have to have that. I believe maybe VA, you have to have that as well. But for like Medicare, Blue Cross Blue Shield, your main ones, just come walk in and come hang out with us. That's great.
Yeah.
We're here to be your primary care healthcare providers. Yeah.
So let's talk about the Pickler a little bit.
Yeah, dude, that's fun.
I'm sure a lot of you guys know there's a company called the Pickler, and it's a chain. It's an indoor pickleball facility. I think the one down here has about 15 courts. State-of-the-art facility, really, really cool. And we had the opportunity to have our tent out there for a little bit and get to meet a lot of good people.
Drew Brees that's his.
I think he might have some partial stake
I think
in the
he's got
company,
some
maybe.
partial
I don't know.
stake in it, yeah. Mm-hmm.
I'm not too sure. But how was your experience?
It was good, man. We love connecting with the community. So we got to see hundreds, about 100, like close to 100.
We talked to a lot of people. I would say around 100 to 150.
A lot of pickleball players. We got to, be there and be on site for them to treat them if they needed to.
Yeah.
So it was really good to connect with the community. We wanted to shout out to the Pickler for letting us come out there. It was good.
Thank you.
We had a lot of good connections. We helped out a lot of people. I felt like we provided a lot of value.
Yeah.
We were able to bring out, some of the ultrasound, do some free screenings. If somebody had a potential tendinopathy, a tweak, arthritis, we were able to elucidate that for them and get them going in the right direction. And we got, a couple patients.
Yeah,
they
worked on a couple of the
Yeah.
people that work there too. So got to meet a lot of nice people. I think the coolest thing is seeing everybody's reaction to saying like, hey, we would give them a quick little workup, 5 minutes, show them the ultrasound a little bit, get them feeling good prior to going in and playing. But also too, the cool thing is following that up with, hey, you can come see us, direct access, so long as you're not TRICARE or VA, and the reaction that people get is just like, no way.
Yeah.
And we've got a couple of people that came in this past week from the Pickler. So I think that was really,
I'm proud
really
we're
cool,
doing our due diligence because physical therapists like to kind of, the general physical therapists, they want to work a job, right? They want to just stay pretty local to their clinic and just work their job, So, but I love it how at Neolife we're getting out and we're giving back to the community.
Yes.
We're not asking for anything. We just want to get out there and serve, because we're, at the end of the day, we're here to like help others. We're here to serve others.
And I think that's. I feel like you might feel this way too, but I think that's what I was called to do.
Calling, yeah.
Heal people. I tell a lot of people. People always ask me why did you want to be a PT? Right? You get that question all the time.
100%.
I'm sure you get it in here a lot too, right? And I feel like I have this call. I wanted to do medical school first, and when I got in here and shadowed, I sat there and thought that night. I was like, look, this is the spot. And I have to do with that energy. You get in here, everything is just great. You feel this certain way that's just hard to express. But, I've found that I feel like I was put onto this planet to help teach people and educate people that you only have one temple. You're given one. So it's important that you take good care of that. And I think that's what I've been called to do. And I think that's why I enjoy being out there and helping provide for pickleball patients out there at the Pickler, people who play every day in that sport, especially with how much we love the sport and how much we're passionate about it. It's the educating that's really, really cool to me because I feel like everybody needs that.
That's a good point because my point of view with it is like life's risky, right?
Yeah.
Applying to PT school is risky. Applying for a job is risky.
Yeah.
Getting married is risky. Having a baby is risky.
Yeah.
But my point of view is like, we're going to die. Just like you said, we had this temple once. There's so much more risk in not taking action than taking action.
Yep.
So might as well take action, get out there, serve the community, and seek opportunity.
Sure.
And that's what I really respect about you is you're a very opportunistic individual.
Yeah. Yeah.
That's awesome, man.
Would you guys say that a key aspect in physical therapy is mindset? It's instilling confidence in the patients. Would you say that plays a vital role in part of the treatment as a whole?
100%. Day one in the initial evaluation, we have to do some paradigm shifting.
You have to develop a trust with the patient too, because a lot of times you have a patient that comes in and they've experienced PT before. They've gone through the trials of PT where it may have not been as beneficial for them, or it may have made them feel worse, right? So there's this preconceived notion of what PT is, especially for the geriatric population, right? Oh, I'm just going to get in there, little exercises, I'll stretch, and they'll pop a heat pack on me at the end, right? Shift the paradigm. And that's the goal on the first visit. It's the mindset, right? Shifting the paradigm.
We have to establish your goals.
Yeah.
Day one. So we structure your plan of care around what do you want to be able to do again? What do you want to be able to do again? And that's how we structure our interventions.
Yep.
So there's this stigma around physical therapy that we're just like professional massage therapists, or we do a couple of, long arc quads, short arc quads and everything, corrective exercise. Physical therapy is a broad spectrum between, yes, manual therapy all the way up to doing CrossFit.
Yeah.
You know what I'm saying? It's a spectrum. I'm a strength coach. I work in the strength and conditioning world, and I've worked in, acute care settings in hospitals. So we have the most diverse ability to apply movement as a medicine to a broad array of individuals.
Yeah.
That's what physical therapy is. It's a spectrum of movement and how we utilize movement in our hands to heal and to promote positive changes in individuals.
Exactly.
Would you agree?
I would agree. And I think circling back to your question, I mean, instilling that into somebody day one gains their trust, right? And it reshifts their mindset. So a lot of it is mindset. Like that was a good question.
Yeah. So with physical therapy, it's important that you do not make that patient dependent on you.
Yeah.
I see a lot of clinics where it's like, oh, you need me to fix you. You need me to fix you. I'm the solution. Well, I disagree because our job is to give patients the tools so they can become their own advocate for their rehab.
Yep.
That's the key.
I like what you say downstairs too. Like I've heard a patient tell Austin, like, man, I couldn't have gotten this far without you, like on discharge day, like thank you for all that you did. And Austin will just respond, I didn't do anything. I just provided you with the tools. You did all the work. You couldn't have gotten here if it wasn't for your actions. And that's true.
Bro, and
that's so true.
And sometimes they get like shredded.
Yeah.
They get like shredded too. I'm like, so, we got you 80% there. We didn't get you because 100% improvement is, they say that sometimes, but objectively, they still have some degree of impairments.
Yeah.
That's very normal. We're never going to be perfect. We're never going to be symmetrical, but you got shredded in the process, you know? So there's no downside to it, in my opinion.
Right.
You get to get out of your house, you get to come hang out with an awesome group of people, and then you get to, move in ways you might have not felt comfortable in a controlled environment.
100%.
So that's the beauty of having such a cool facility, because you get to express motion, you get to express different ways of moving that you're not used to. They might be painful, but we can help you work within your pain threshold.
100%.
So it's really cool. It's a cool job. It's a weird job, but it's a cool job, man.
It's awesome, man.
It's nuts. It's nuts.
It's awesome. I'm happy with where I'm at.
Yeah. Talk to me about, we said we want to talk a little bit about rock flossing today.
Yeah. So rock flossing.
Yeah.
So
Jabash, can you pull up an image of like a rock floss?
I can.
like a quick cut to it, and then back into.
In the edit.
Cool.
the edit.
Yeah. Sweet. Yeah. Yeah. It's pretty cool. Like Kelly Starrett, the Ready State, he's got like a lot of cool pictures of rock flosses.
Yeah. So I use rock floss is like it's a rubber band, like a thick band and you utilize it as kind of compression around a joint, a singular joint. So you could use it on shoulders, your elbows, your knees, your ankles. And so essentially what we're doing is we're providing a compressive force to this joint and actively moving it throughout ranges of motion, right? And what we're trying to elucidate is basically recycling the residual fluid and the swelling back up to the venous system, back up to the heart, right? A lot of that joint effusion, just trying to get rid of, think of it as like flushing out the garbage. But the beauty in it is when you take that thing off, you get this influx in blood that rushes back to the area that area needs for good oxygen and nutrients to help support and facilitate good, strong, healthy, soft tissue. That's kind of like my layman's terms for it when I explain it to patients.
Yeah,
you know? And
it's a super effective modality.
Yes,
and
yes.
You move with it as well.
Exactly.
So like you're moving back and forth with it.
And like you said too on the first day, sorry to cut you off, but
No, you're good.
You remember the first visit, you're like, okay, essentially, not the first visit. I say visit way too much downstairs.
we're
The
still in
podcast,
work mode. We're
the
still
first
in work
podcast.
mode.
But at the end of the day, right, ice is not going to completely just get rid of swelling. What's going to evacuate the fluid is movement, right? So I think adding the movement in conjunction with the compressive force is really, really helpful. Yeah.
It's similar to BFR in
Yep.
a sense, but it kind of disperses over a broader surface area,
Yeah.
broader cross-sectional area of tissue.
Yeah.
BFR, on the other hand, we use that a lot here too. So blood flow restriction therapy, that's what it's called, BFR. So essentially you're tourniqueting an area and you're restricting arterial and venous return to an area, and you're getting this huge accumulation of lactate. Lactate's like that term, lactic acid is the term that you get when you have a burn, when you're working out. You get lactate, hydrogen ions build up. And essentially, we use that mechanism to induce, positive changes in patients. So essentially, you can work out at around 20 to 30% of your 1 rep max and just rep out like lightweight. And you get the same benefit as high intensity strength training.
Yep.
Because why is it so? Like for a certain patient population, who would it be good for? People who are in pain who can't like tolerate heavy load very well.
Yep.
So essentially, the pituitary gland in your brain recognizes that lactate, and it's like, oh my god, holy crap! Like we gotta like send some guys there. So the pituitary gland sends out like growth hormone, insulin growth factor 1, IGF-1, and then you get the same benefit as like high intensity training. That's kind of like a technical mechanism behind it, but it's like the layman's term is you can use blood flow restriction therapy to get the same benefit doing like as you would do like heavy resistance training by doing less weight. So it's a cheat code.
Cheat code.
Cheat code.
Cheat code.
Yeah, I told my mom I would quit saying the F word.
Yeah, I'm proud of you, man.
Thank you, man. I'm working on it. I'm trying to be a better person. Good
job.
Yeah,
Is there anything you guys want to wrap up with?
What do you think, Jeff?
So I think we covered a lot of good points today. And I think one thing that I'm starting to learn is with this podcast and with kind of what you told me downstairs is all this stuff, and this is more of a personal thing, right? Is this communication is hard to do, right?
Hard.
It's such a skill, right? And it's cool to be able to do this in this environment and be able to provide these podcasts for you guys because one, we're not only helping give you guys some education, but also it's helping me out too, right? 100%. I think it's cool to do. And we got to get you.
Man.
Back here one of these days.
For
man.
sure.
Yeah.
For sure.
Yeah. Communication's huge. I love to self-reflect on what we said and everything. I'm like, you know what? I probably could have said that a lot better. Or,
Yeah.
man, I didn't sound too good saying that. But
Well, my issue is always I need time to be able to articulate or figure out how to articulate what I want to say. So a lot of times I can say it well, but it just takes me some time to articulate it. And the skill is being able to articulate it quick, right? I think you do a really good job of that.
As a therapist, it's essential to communicate your information effectively to the patient so they can get better. But to wrap it up, like tough conversations.
Yeah.
We have to have tough conversations. I saw this quote, and it was you're usually 2 or 3 tough conversations away from what you want in life.
From what you want in life.
So if you have a tough conversation that you got to undergo, just do it. Have the tough conversations. Have the tough ones. It's important. It's important because we don't communicate and we bottle it up, and then that's going to manifest itself negatively one way or another.
100%.
Well said, fellas. Well said.
Podcast number 3.
Podcast number 3. That was good.
Batch, do you have any closing statements you would like to add?
All I got to add is stay tuned for the next episode.
Stay tuned, baby.
Well, we're gonna come up with a name for the podcast soon. We're still working on that, guys. We're still working on that.
It's important. We gotta spend time on it.
Yeah.
Good job, guys.
Cool.